Hello and welcome to CGEn's podcast series Synapsis. My name is Naveed Aziz and I serve as Chief Executive Officer of CGEn, Canada's national platform for genome sequencing and analysis. I'm thrilled to welcome you to our podcast series, which aims to bring together experts from across Canada to discuss the Canadian life science ecosystem, the current state of the affairs, and the ideas for the future direction of science in Canada. Today, I'm pleased to welcome our guest speaker, Martha Crago, on the podcast. Martha, thank you for joining us today.
You're very welcome. It's my pleasure to be here.
So Martha is McGill University's Vice Principal of Research and Innovation and Chair of Governing Council of Social Sciences and Humanities Research Council, or SSHRC. Brief introduction. I'll try to keep it brief. There's so much to talk about, but Martha received her BA in Sociology and Anthropology from McGill University in 1968 and a PhD in Communication Sciences from McGill in 1988. Martha has served at McGill and University of Montreal for many years. She was the Vice President of Research at Dalhousie from 2007 to 2007 until she accepted her current position at McGill. Martha has also served as a visiting professor at the Max Planck Institute of Psycholinguistics. She was appointed as a member of the Order of Canada in December 2017. In 2020, Martha received an honorary degree of Doctorate of Science from University of British Columbia in recognition of her work in advancing university research and learning in Canada and beyond. And just recently, on March 22nd, 2022, Martha was also presented with a Knight's Cross of the Order of Merit of the Federal Republic of Germany, which I didn't know, Martha. So congratulations. What an amazing recognition. So Martha, I'm very excited and looking forward to our discussion today. But I think before we get really into it, just for some of the younger community and the ECRs in our ecosystem, I was wondering if you would share a little more about yourself and mainly your career path and what brought you to where you are today.
Okay, so let me correct any misgivings that it took me 20 years to do my PhD. I had a very irregular career path, atypical of many academics that go on to tenure track immediately following a PhD or postdoc. So I actually did a master's in speech pathology, but I also became a faculty lecturer the minute I got that degree at McGill. Teaching courses on how children learn languages. And while I was being a faculty lecturer, I did a number of very interesting projects, basically, that took me to various parts of the province of Quebec, including the Arctic, because I started teaching in a program where we teach teachers, Inuit teachers, how to be teachers, and I was teaching the course in language development. But I don't actually teach that course because it's taught in Inuktitut. So I work with very experienced Inuit teachers to teach it and begin to realize that both the language the children were learning and the ways in which people were communicating with children were extremely different than what we knew about English and what we knew about white middle class norms of socializing children. To communication, through communication. So I decided to do a PhD, and at that point, I did it actually with 3 children under the age of 5 and quite rapidly in 3.5 years, and then went on tenure track at McGill, where I had been a faculty lecturer and doing projects all those years. So from then I became a grad dean about 7 years later. Because I thought my recency of graduate experience plus my maturity and my project management skills would serve me well. So I did that, kept up my research looking at Indigenous languages and bilingualism across a couple of different languages, and then moved on to becoming a VP International at the University of Montreal for a few years, and following that went out to Dalhousie as a VP of Research and was lured back to McGill in 2017. But actually the great part about this career and its irregularity was that I learned a lot of skills at each point in it and then could bring them all together in the jobs I have now. And I will tell you, being the VP research is the best job in the university.
Yeah, I don't doubt it. and it's a busy job, and it's a lot to do. But obviously, as they say, all the good jobs are a lot of pressure and a lot of work. So yeah, absolutely. And you're doing a fantastic job of having worked with you for many years now, and seen you kind of work in the ecosystem. You're doing an amazing job. So thank you for
Thank you.
Okay, thanks for that, Martha. I think to kick things off and talk a little bit about the topic of genomics that we wanted to tackle today. I will preface with the comments that the central role of genomics was recognized earlier in the current pandemic. Rapid sequencing of the SARS-CoV-2 virus, underpinned by the quick developments of the vaccines, subsequent work around the world and in Canada through CanCoGen, funded by Genome Canada, to sequence the evolving virus and the genomes of the people who were infected, where CGEn was involved, has added greatly to our public health responses to the pandemic, and also to our knowledge of COVID-19. So, as did many countries, Canada made significant investments in its institutions conducting genome research during the crisis. So today, as we look to the future, what in your view are the opportunities of genomics research in Canada?
Okay, so let me begin with two brief stories for you, because I think it'll help me frame what I'm going to say. One was riding in a car, and this must have been maybe winter 2021 or slightly maybe the fall of 2020, when CBC was interviewing people on the street about what new vocabulary they had learned in the pandemic. And they asked this one woman, and she said, "I learned the word genomics." And I remember stopping the car and writing an email to the genomics researchers at McGill saying, "Your moment just came." And I think it's important because the layperson on the street understood. And the piece of my history that I didn't tell you about is that I come from a breast cancer family. So 4 generations of women lost to this disease, and a 20-year search to figure out what the gene was, what the mutation was that was affecting my family. So I had my own personal experience with the power of genomic research for and understanding the genes in our body, for what it can do for diagnosis, for what it can do for prevention. And then, of course, COVID drove home a whole bunch of other things to us. We all learned the word, everybody who didn't know it learned what a mutation was and how they change and evolve. And then the Nobel Prize to Doudna and Charpentier taught us, gee, maybe someday there's going to be gene therapy. And we certainly got used to the term personalized medicine and precision medicine. And I began to see even some of that developing in the treatment that my sisters got for breast cancer. So I think the public is beginning to ingest, perhaps more at the educated end of the public, what this is and what this can do for health in particular. And I think that is a signal, frankly, to the government that they have a set of voters. So if we think politics matter in some of our thinking and decision making, they have a set of voters that have become aware of the potential and the importance of something like genomics in the middle of a pandemic. So there's a lot of promise on a lot of fronts for this, and increasing awareness among the public. And that will lead to increasing expectations by the public that we will be able to do precision medicine in Canada, that we will have diagnostics of a certain kind, that we will have the capacity to sequence in the country. So these are things that, I think that the government has to wake up to. And another personal story I'll tell you is that I had a granddaughter born who failed a screening test for a rare genetic disease. It turns out she's just a carrier, and so not suffering from that disease. But it took 4 months as her full sample was sent to the US to be sequenced. Now, I knew I could get it in 24 hours on the McGill campus, but that would not have counted as an official diagnosis. So, the public will start to say, why do we have to send to the US? Why do we have to wait 4 months where we're terrified the whole time? So, I think people are going to start to expect differently, and this government has to rise to those expectations and rise, frankly, to the potential for this kind of research and what it can give to its population.
I couldn't agree more, Martha. I think, as they say, genomics has gone from laboratory to the street, and and people understand. And now, as you say, now that people understand the potential power, they're going to demand, its implementation, so to speak.
Mm-hmm.
Absolutely. So just taking that a little bit forward. So what do you think you talked a little bit about what the government needs to do and kind of think about, but in specifically for the community as well, the research community as well, what do you we need to do more, or all the stakeholders involved do more or change in order to reach our maximum potential in terms of the impact on the society?
Well, I got some help from somebody who was a previous government bureaucrat to look back and see, well, where did this all begin? What happened here? How did Genome Canada get formed? What year was that? And you realized at the time that it was formed, this was the beginning or the heyday of the Human Genome Project. And so this new organization was put together by the government in a very, a kind of a foresighted way, or at least to catch up to where things were moving rapidly. Now, since then, so that's quite a while ago. That's just around let's just say the turn of the century. So now it's almost 20 some years later. And now it seems to me what's happened is we have quite a fragmented situation. We have equipment funded by CFI. It used to be able to be matched by Genome. It's not so clear what that's going to happen. We have these regional offices. How are they really incorporated well with the main office and main country thrust? And we have some money going through CIHR and an Institute of Genetics at CIHR. We have immediate concerns by things like Public Health Agency when in a time of COVID. And all these things seem to be running in kind of scattered and scurrying circles, particularly during the pandemic. Suddenly, people had to find something to help us with sequencing the virus, then hunting for variants. And at the 11th hour, things are put together in a kind of urgent and perhaps not clearly thought through way. So do we have an ecosystem? I wouldn't call it an ecosystem. I call it a whole bunch of separate little bits and pieces that get cobbled together either in a panic situation like a pandemic or get loosely disconnected because the dates that you submit a CFI are not the dates you can get your genome match. So we have all kinds of muddling in the circumstance, and perhaps not as clear a connection to public health as we need to have an ongoing connection to it. So the resources are there in a time of panic, and the resources are there in general to help the public health of the country. So I think right now we're really at a turning point, and we can either figure this out and get a sensible, well-structured, well-supported system in place, or we can let it go on being this kind of random shuffle with bits and pieces disconnected, a little less connected, perhaps sometimes better connected, but not in a systematic way and not in a strategic and prioritized way. So we've got many pieces, we've got many tidbits of funding going out here and there, but there isn't a central strategic plan in place. And it needs several people to come together and to figure out this plan. And this is, I've been talking mostly about health, genomics, but I'm certain in the world of agriculture, and I do know from my time at Dalhousie that in the world of oceans and ocean resources, there are genomic issues that need to be sorted out. And I would guess they suffer from some of the same confusions. you see bits and pieces of monies in budgets. So we have some precision agriculture money in this budget. We had money for genome, 400 million in a different budget. And little by little, they're pieces of money, but it's not well orchestrated.
No, I absolutely spot on. And I think one of the keys to maximize our outcomes will be these partnerships and working together and collaborations. And what you just said kind of leads very nicely into my next question. That there are, as you said, there are many organizations, groups operating in the Canadian so-called ecosystem, and the COVID-19 pandemic really showed us that coordinated efforts, as you say, are required to quickly and effectively react to emerging challenges. And I think we did given the circumstances, when when you're in the Canadian system and know from the inside some of these challenges, we did a great job at delivering what we did. As I said earlier, CanCoGen through funding through and Genome Canada and all of that, we did a great job. But that doesn't mean that it was either easy or challenge-free or it was planned. To be honest,
yeah, it wasn't planned.
It was delivered somehow. But
yeah.
I think one of the reasons was because a lot of people was very willing to do things because of the pandemic, which in normal circumstances they were probably not. So I think that helped. It's a true Canadian way.
Yeah.
But that's not the way the future should be planned, right? You can't work by panic mode, so to speak. So in that sense, how important do you think it will be proactively to define roles and responsibilities of all these different players in the ecosystem to build these collaborations to overcome future challenges?
Yeah, I mean, I think you first have to figure out who are the players in the ecosystem. Is public health one of them, for instance? Is CFI one of them? Who are they? Is CIHR one of them? So who are all the players that need to be there? What about these regional genome centers? Are they one of the players? And then figure out what are the roles and responsibilities and what are the kinds of funding to meet the role and responsibility that different players need to have, and how do they work out that funding works well amongst them? Because if you don't figure out the coordination of it, and everybody just gets a dib and a dab of funding here and there, and nobody's figured out how it's orchestrated, then it will still be in a kind of a muddled ecosystem where, yes, we all know we're in the stew pot together, but we don't really know how our different pieces lead to the totality of the stew. So I think it is going to be very important to define the membership of, call it a coalition, call it an ecosystem, and then figure out what everybody's supposed to be doing in it, and then figure out what does that mean that they need for funding to do it effectively, and for this country to develop a capacity that is a real and meaningful capacity.
Yeah, and I agree. And I think when I think about these things, sometimes I think like almost almost need to work backward as to where we want to be in 3 years, 5 years time,
Mm-hmm.
and then figure out what are the components that are needed and who are then the best players to deliver those components, right?
Yeah.
And then get them around a table and say, okay, this is what we want to build, right? And we see these are your roles. Who wants to step up?
Yeah.
Right? And give them the responsibility to step up.
Yes, and then the next thing you need, and I think the government needs more engineers who know how to do Gantt charts. And then you need to figure out how all these different pieces of responsibility and role fits into a timeline and a time chart that makes sense. Because the minute one goes off and has one set of timelines and the other one has a different set of timelines, then you're in a real dilemma as how to make them work together. So there has to be a true orchestration and organization of it. And people need to actually look at timelines so that they can see what makes this doable. Yeah. Now, pandemic, you don't have that kind of timeline. Yeah. But if you have your backbone structure and you know what everybody's role is and you know how they engage with each other, people can adjust some kind of timelines to a more urgent mode in a situation. But the biggest lesson I think we learned about the pandemic is post-SARS, we never left everything in place to perfectly handle the next pandemic. And we can't make that mistake again. I mean, you don't have to learn twice. You should learn once. We didn't. Now we have the next learning time. And you're right. I think the fact that CGEn existed gave a basis that the government could build on with CancoGen, and did. And that's very important. But if CGEn hadn't been there, it wouldn't have worked so well.
Yeah, no, I again agree. I've been in the Canadian system for the last 10 years, coming from the UK, and I see some parallels from the inside, so to speak. And I feel like there are some really good key components that are present right now. CGEn self promotion, CGEn being one of them, but there are other key players that are already there. You mentioned Genome Canada and the genome centers. I think because the way Canada is spread out, these provincial reach is important. But I think that in my view, there's got to be some evolution of how we have worked in the last 20 years, right? Some of the things, not all, but some of the things were perfect 20 years ago, but they might not be now. So that, again, coming from outside, and that one thing that hit me when I came here from the UK earlier on, Pierre Moulin, who was the Genome Canada CEO at the time, he essentially brought me into Genome Canada. One of the things that struck me at the time was that there was some really nice components to the genomic system in Canada that even at that time, at least, even UK didn't have, right? But as time passed, I saw UK kind of shooting through and evolving, whereas I struggled and got frustrated on this side with a lot of things that we really didn't push in Canada. And it was, to me, it's always feels like we let others do it and then see if that's working or if it's good, and then we try and replicate it. But then we forget that replication directly doesn't work because, for example, again, UK's example, small country, no provincial jurisdictions, and it just doesn't translate directly. We can look at them for guidance, but it's not a translation, right? So
yeah,
these are the things that we need to figure out. Really, we have some components. So to kind of wrap up or start to wrap up the conversation, it leads nicely into, I want you to talk a little bit of recognizing the importance of Canada's genomics ecosystem. As I said, there's a lot of good components out there, and the government of Canada, led by Science and Economic Development, or ISED, announced $400 million for a Pan-Canadian strategy in the 2021 budget. So thinking about that, what in your view will be some of the important considerations as ways that this Pan-Canadian Genomics strategy and other government strategies and programs can help support the future of genomics? I know we talked a little bit about, in general, but do you have some kind of key nuggets for ISED and for others to consider that they should really be focusing on to get forward?
Okay, well, let me start with an overarching thing. If they start with the total goal being commercialization, you probably won't get, frankly, as far as you want to go, because you've got to start with a goal, particularly for medical genomics, that has to do with health and all the things that I talked about before about taking care of people's health. So I think this is going to take some careful consideration, because ISED's job in part is science and in part is business and research and development in a development way. So I think we've got to have recognition that you can't let go the science part and expect to get to development, and you can't only be pushing on development and commercialization because it'll leave the science behind. So some very good things that people have to think about is, how do you keep things moving on both fronts? Because if we don't develop some actual therapeutics and diagnostic techniques, well, then, we're also letting down the healthcare of people and not translating science out into the public. So there has to be a translation component at some point and a commercial component, but you can't abandon the science component. That means you have to figure out how do you fund things like data banks? How do you have something and how do we break down the remarkable provincial boundaries around data sharing? So that we don't become one of the lowest ranked countries in the world in terms of sharing our data internationally. We have important data to share. And so I think, there's a set of fronts to work on, and they have to involve commercialization. They cannot neglect science, and they have to have an essential way to deal with data, because that's the backbone here. Is this is producing big data, and there has to be a way to manage that data so that it's successful for the country, frankly, and not for the fiefdoms, of the provinces. We have to not let federalism trip us up in our attempt to get something out to a population of something that is a country. Quand même.
Absolutely. Well, thank you, Martha. Thank you for your insights. I think the intent of our podcasts are to just keep them kind of short and crisp, so that people can listen to them when they have a little bit of time, and just bring some wisdom from some of the Canadian leaders to the research community and to the stakeholders. So I wouldn't take too much of your time. Thank you so much for your time. I know you're so busy, so I really appreciate it. And I hopefully expect your leadership to continue in the area for science in Canada. And honestly, while genomics is close to my heart, but to truly not just genomics, but science in general in Canada, because we need strong leadership in Canada to continue our excellence. You've been one of them, so thank you for all of that. And thank you for your time.